Hi, and welcome back to our podcast, Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, and I am an editor at Psychotherapy Academy, where we share practical tools and insights with psychotherapists like you. We're here to support you on your journey to help others, knowing the unique challenges you face in your crucial role. Today marks another special episode in light of our Therapy Pro membership and our Clinical Cases resource launch. In these offerings, you'll get to delve into the minds of expert clinicians as they unpack complex conditions and provide actionable strategies through modalities like cognitive processing therapy, ACT, DBT, and more. Not only will this deepen your understanding, but you'll also be able to obtain CE credits while at it. In celebration, we're bringing you a series of episodes that give you a glimpse into our clinical cases, with today's spotlight shining on the process of working through trauma memories with exposure therapy. Exposure therapy is a pivotal element in the treatment for trauma, allowing clients to confront and process traumatic events in a safe and structured way. Today, we'll be discussing the journey of Deborah, a client with a background in journalism and communications, who engaged with her traumatic experience through the power of writing. With the guidance of her therapist, Deborah constructed an exposure hierarchy to address her trauma memories, a method often employed in cognitive processing and prolonged exposure therapies. Our discussion will touch on the traditional and ACT-based approaches to exposure therapy, the importance of validating emotions, and the adaptive process of rewriting narratives with deeper emotional connection. We'll dissect the nuances of this therapeutic approach, how it's tailored to individual needs, and the impact it can have on a person's path to healing. Our faculty member is Dr. Sonja Batten. Dr. Batten is the CEO of Flexible Edge Solutions and Vice President of Programs for the nonprofit organization Stop Soldier Suicide, where she leads all clinical programs and innovations. Dr. Batten was the first Deputy Director of the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury and the first Associate Director for Women's Health Research at Yale University. She is also a certified executive coach and ProPsy change management practitioner. I'm thrilled to have you with us as we navigate the complexities and the therapeutic potential of exposure therapy in trauma work. So let's begin this journey into the heart of healing.
So in future sessions, the client agreed to try to work on those trauma memories, and we prioritize them as an exposure hierarchy. So you can read about exposure from a behavioral perspective through cognitive processing therapy or prolonged exposure therapy. There are different ways that you can do exposure. It can be written, it can be oral, it can be recorded, and the person listens to recordings. But because of her journalism and communications background, she felt like the way that she would like to approach that was through written exposure. So we agreed that we would do several weeks of written exposure and have it be time limited. So she didn't have to feel like this was going to go on forever, but that we would do 2 weeks for each traumatic event. And I had her sort of rate the level of distress that each of the traumatic events currently brought up for her. And so the lowest level of anxiety was that teenage attempted rape. The second one was the combat exposure, the distressing things that she had been exposed to as she traveled with her combat unit. The third was the recent attempted assault by her supervisor. And the fourth, the most distressing one, was the rape that she experienced in Afghanistan. So I gave her a prompt based on the cognitive processing therapy prompts for writing about the traumatic event, to write about the traumatic event with as many details as possible, and also include how you feel like this experience affected your thoughts about yourself, others, and the world. The idea was she would write about it outside of session and then come to session and read the account out loud. And the first session, she had also not followed through with doing that, which again is super common with trauma survivors. And so we explored what got in the way of her doing that in a non-judgmental way. And we actually started the process of writing about the event in session just to give her a start on doing it. So she came back the next session and ongoing sessions, and she would read the account out loud. I would validate her experience, her emotions. And after the emotion had started to settle down a little bit, I might ask some questions or give some feedback about elements that seem to be missing or lacking emotional description. And then each time I would ask her to go home and rewrite that narrative for a second week with more emotional engagement. And in that second week to read the account out loud to herself, preferably once every day. So we did this with all four of those events in the hierarchy. You don't necessarily have to talk about every single traumatic event, especially when you're talking to somebody who has multiple traumatic events. With her, it seemed like that was a time limited enough approach to have 8 or 9 weeks focused on exposure. But I certainly have had clients where we either purposefully choose not to go into every traumatic event because there are too many, or the person starts working through the hierarchy and may experience enough improvement that we don't need to keep going. The main difference between traditional exposure and ACT-based exposure is that traditional exposure is more based on a anxiety habituation and attenuation. In an ACT model, we can ask for subjective units of distress, for example, as part of exposure, but we're doing it really for awareness and mindfulness, not looking for that number to go down over time. Because from an ACT perspective, we don't believe that people necessarily have control over the level of their emotional response. And there are some things like guilt and shame or grief that may not ever go down. And that's okay. From an ACT perspective, we want to work with the person to be able to live and move forward even in the presence of those experiences.
Okay, so to close today's episode, let's reflect on the journey of working through trauma memories with exposure therapy as seen in Deborah's story. We've explored the layers of exposure work, understanding its significance in the healing process for individuals like Deborah. With the creation of an exposure hierarchy, Deborah engaged in a delicate dance of confronting her past, a testament to the strength and resilience that lies within our client. We examined the methodical approach of writing and rewriting trauma narratives, a process that empowers clients to reclaim their story with authenticity and emotional depth. This narrative work is not just about revisiting trauma, it's about reshaping the relationship one has with their experiences. The journey through the hierarchy of traumas, from the least to the most distressing, underscores the tailored nature of exposure therapy, ensuring no client is overwhelmed. Deborah's story illustrates that while all traumas may not be spoken, the ones that are addressed pave the way for profound shifts in healing. Traditional and ACT-based exposure therapies offer different lenses through which we can view and navigate emotional responses, teaching us that it's possible to move forward meaningfully, even in the presence of intense emotions. Today, we've gained insights into the mechanics of exposure therapy and also into its spirit, the idea that facing our past can be the first step towards a future of resilience and meaning. Okay, so that's all for now. Stay tuned for forthcoming episodes, in which we'll present more practical psychotherapy tools through a case conceptualization lens to honor the launch of our subscription-based resource, Clinical Cases, and our Membership Therapy Pro. If you're a psychologist, counselor, social worker, physician, marriage and family therapist, or addiction professional, you'll find these invaluable for your practice. And as icing on the cake, you can also earn CE credits. To learn more about membership, accreditation, and Clinical Cases, click on the link in the show notes. You can also access exclusive content that isn't included in this podcast. If you've enjoyed this, kindly help us to spread the word by leaving a review on Apple Podcasts and sharing it through social media or word of mouth. We are so grateful for your support. And thanks so much for tuning in. This is Dr. Jessica Díaz, looking forward to seeing you again soon for the next episode. Bye-bye.